A local pediatric intensive care unit closing its doors for good. Providence St. Vincent Medical Center just announced the closure of its PICU, citing low demand. Local nurses now calling that move abhorrent. 155. That's how many days last year Providence St. Vincent says its Pediatric Intensive Care Unit, or PICU, sat empty. On days when the 4-bed unit wasn't empty, officials say they typically had only one patient.
When we opened this PICU back in 2012, there was thought that there would be more population growth and more demand for critical care services on this side of town.
Now come November, St. Vincent's PICU is closing its doors for good. Providence says they will still be able to provide care to babies and kids in other capacities, as their inpatient pediatric unit, NICU, and children's emergency room will remain open 24/7. But for critical care, patients will have to go to Legacy or OHSU.
From a severe respiratory illness, if it's so severe that they need support from a ventilator, and those are cases that we just don't take care of here.
The upcoming fall and winter respiratory season is the very thing causing concern for the Oregon Nurses Association. They sent KOIN 6 this statement, quoting an RN at Providence St. Vincent. It reads in part, quote, "We've always been busy during respiratory virus season. We have also advocated for years to be cross-trained so that we can serve more than just pediatric patients, and have repeatedly been told there is no budget." Providence says they lost $3 million in costs at St. Vincent's PICU just last year alone. St. Vincent's Pediatric Intensive Care Unit is comprised of 20 registered nurses and 3 medical doctors. Providence says they are hoping to find those caregivers other positions within the organization.